Now, over the weekend, Georgia marked the deadliest day since the coronavirus pandemic began, with nearly 180 deaths reported in a 24-hour period. This as the Super Bowl is now causing worries about super spreader events and what they may mean. Joining us now with the latest virus trends, Emory's Dr. Neal Winawer. Good morning to you, Dr. Winawer.
Good morning, Caitlin.
All right, let's talk about those latest trends.
Well, the number of cases nationally is down to about 125,000, still very, very high, but better than we had weeks and weeks ago. But deaths typically lag, so you're going to see still a high death rate, and hopefully over the next few weeks, those numbers will go down significantly.
You always like to share the latest studies. What's the latest ones this week? Anything important?
Yes, there were three interesting vaccine studies that I saw that came out. One is news reported from Israel. Israel has done a really good job vaccinating their elderly community, those over the age of 60. And since they've been vaccinated, they've seen a 40% reduction in cases, which is very encouraging. And 80% of that virus spread right now is with the UK variant, so it's good to know that vaccination, even with the UK variant there, has led to significant reductions. In Russia, the Sputnik 5 vaccine has shown to be over 90% effective, which is significant because Russia is going to be supplying the rest of the world with vaccines, and this is a global pandemic. So that's important news as well. There was disappointing news out of South Africa. The AstraZeneca vaccine was pulled in South Africa because it didn't prevent mild or moderate cases. It may prevent severe cases. We'll see in the next few weeks when that data comes in, but it didn't do a good job in preventing mild and moderate. And obviously that's a concern, particularly the South African B.1.351 strain.
For sure. So a lot of studies still up in the air right now. We're waiting for results. All right, let's talk about this. A whole lot of people talking about this one, Dr. Winawer, with 22,000 fans in attendance at the Super Bowl. And of course, a lot of action in Tampa Bay and at Super Bowl parties here in our area. Do you think we're going to be seeing an uptick in cases as a result?
The short answer is yes, but not compared to the holidays. I think there's levels of responsibility or irresponsibility. Having a party at home with members of your own household is reasonable. Having members of different household, if you were able to have it outside. And then in terms of increasing irresponsibility, having different household members inside or at the bars as you see here. You know, I had a little Super Bowl party myself. It was just me and my immediate family. There was nobody there to taste the award-winning chili that I made, but hey, it's okay. That's more for me, you know? So it was unfortunate, but it is what it is. And hopefully the majority of Americans were responsible about this. So I think we'll see a little bit uptick, unfortunately. And there's a concern, obviously, because of the more contagious variants. But I don't think it will be anything like we saw during the holidays when we had all those people traveling.
For sure. Okay. Finally, this week, the administration created a little bit of confusion, I guess you would frame it as, when CDC Director Rochelle Walensky said during a briefing that safe reopening does not suggest teachers need to be vaccinated in order to reopen safely. Unpack this. Tell us what this was all about.
Yeah, this is a concern because teachers are very concerned about going back to school, and politicians want, people want their children to go back to school. I obviously understand that we've seen a lot of negative side effects of kids being out of school, but we also have to listen to our teachers. And this is a simple question that you've asked, but it has a complicated answer, because the first thing I would say is, what is the percent positivity of the disease in the specific community we're talking about? If it's over 5%, the CDC has always said that's risky. You want to have the percent positivity test rate in your community below 5%. So if you're below 5%, if the boards of education have put really an investment in spreading out seats, ventilation, and air purifiers, that could ease a lot of the concerns that teachers have. But I think teachers have a right to want to be vaccinated before they go back in these high percentage positive areas. And I think we have to work with them. We have to figure out, like I said, there's not a one-size-fits-all approach. You have to look at how high the prevalence is in your community and try to get teachers vaccinated as soon as possible. But I'm very, very supportive of our teachers as well. We don't want to put them in a situation that's very concerning to them. The one thing I will also say, another thing is, that you have to also ask, what grade are we talking about? The kids in kindergarten through 8th grade seem to not spread the virus to the same degree as those in high school above 9th grade. So we also have to be concerned of what grades we're talking about. So really this may be a layered start out or reopening depending on each specific situation that I mentioned.
Spirited conversation resulting from all those points. Thanks so much, Dr. Winawer, and I'll be messaging you for that award-winning chili recipe.
You can have it anytime, anytime.
Have a good rest of the week.
You too. Take care.